Can everyone see my screen?
I don't think so.
No? Okay. How about now?
Got it now. It's good.
Okay. Oh, no. Okay, great. Cool. Okay, like Austin said, Kat and I are here representing Michigan Movement, and this year we are one of the 2 community partners with Music Matters. This is actually our 2nd year in community partnership with them, so we are very excited to continue this relationship. In our presentation today, we're going to talk to y'all about what we do as an organization, what we did this year during COVID, and we will play a clip at the end of our last education event that we had. So Kat is going to kick it off with describing who we are.
Yeah, so to introduce our organization, it is currently the only org campus that our primary focus is to provide aid to individuals in the local community who are experiencing homelessness or poverty. And we kind of have our cornerstone being working with the community and not for the community. So developing a lot of really meaningful relationships and being hands-on. So we have our 3 Ps, our 3 pillars almost of the org, which are providing basic daily necessities through our volunteer events that we'll discuss a little bit later, through promoting individual autonomy using education, health, and wellness, and through passion for our community engagement and social advocacy. So of course, because our work is so hands-on with the community with social distancing guidelines, we had to get quite flexible and creative during COVID-19. So we were lucky to be able to continue volunteering in the community with a few restrictions, and we'll talk about exactly what that looks like in future slides. We were able to work on member education through having some book clubs and showing videos and having some really meaningful discussions based off of that content, through pushing forward an edge of social and political advocacy, and through mutual aid.
And so usually, like in past years, we've been able to, when we, in our partnership, bring Music Matters members into a lot of our events that we're doing, have them come to volunteer sites. But really, like, it's so important for us to collaborate with them because one, like both of the initiatives that we do, both MIM and Music Matters, is rooted in the local community. We care a lot about partnerships. Obviously, we're partnering together, but see that our work can only be enhanced by our other people that collaborate with us, and that really it's working together in which we can like further our missions. And we also think that we share the goal of leveraging resources as U of M students, whether that be money or whether that be access to information or other resources to uplift community expertise and initiatives instead of just doing our own. And we both have our mutual commitment towards lasting change, a sense of togetherness and inclusivity.
So now I'm going to talk about how this partnership really was able to make some of our projects come to life and be possible. We have every single year something that we call Memkit Distributions, where we gather these care packages with a lot of personal hygiene items, lifestyle items, and packaged food items, as you can see in the photos. And all of these care packages are really carefully curated based on feedback that we get from the community. So it has items such as toothbrush, Vaseline, socks, hand warmers. We included masks this year. And the money that we received through this partnership allowed us to have high quality products tailored to what was requested. And we were able to have 2 Memkit distributions this year, one on November 14th at the Delana Center and another on March 5th at our warming center locally in Ann Arbor. In the years, trying to expand these Memkit distributions to have more connections with partners with the similar mission to us, helping to provide things such as birth certificates, other healthcare, haircuts, food, but we were a little bit limited this year.
Yeah, it was sad that we couldn't do our normal in-person event downtown, bringing in lots of different vendors and different agencies to kind of link everybody in one spot. But we were able to go and do kind of like satellite things at the agencies that already have locations, and we just kind of posted up outside and did our distributions there. I'm going to talk for a second about volunteering, because this is kind of a core piece of how members of Michigan Movement kind of develop passion or kind of get really excited to do our other programs. This whole year, I would say this semester, both fall and winter, we were able to do in-person volunteering at Mercy House or Ground Cover News. And whether or not you want to join MIM and volunteer with us at these places, you should just seek them out and try and get involved. Mercy House is a hospitality house in Ann Arbor. It's one of 2 houses like it. There's one in Ypsi called Peace House, and they do, it's kind of just like an open space at Commons for folks who are experiencing poverty or homelessness. There's laundry services, meals, usually dinners, but the one that we go to is Saturday breakfast. Take showers, just use the bathroom. But the best thing about it is truly the company and the family that is there. This has been something just integral to my college experience. I've been going on Saturdays, we'll be going tomorrow, since I was a freshman. And it's a really great chance for folks at U of M or just people in MIM to come and kind of just develop in friendship with the people that we aim to help in our different programs. Another place that we volunteer is called Ground Cover News. This is another important agency to me. They are a street paper in Ann Arbor. You might recognize these papers here, folks selling them on the street corners. They're $2 and vendors can buy them for 50 cents and they have a $1.50 profit on it. But it's just it's a low barrier way to have a job and to make money. It's the model is called a microfinance, a micro loan, and it can really help build autonomy and help folks make money if they don't have different ways that would usually cause a barrier to getting a job.
So something else that MIM really values is hearing the voices of members who have struggled with homelessness in the past and hearing their stories. So each year we try to put together a speaker event. And this year we were able to hold a webinar centered around homelessness and its impact on mental health and how the two intersect. So we had 4 wonderful speakers come and give us their knowledge, answer some questions that we put together ahead of time about how homelessness may prevent one from adequately caring for their mental health and create barriers, as well as the vice versa, how homelessness can impact one's mental health. So we wanted to share some clips from that webinar and show you guys what they had to say.
Okay, so I'm going to play a video from this, and let's hope that I can pick the correct section that I want to play. Does anyone know how I can manipulate what? Okay, I think I'm actually not going to do this.
Yeah, real fast. If you want to be able to pick certain sections of the video to show, you may want to screen share it.
Okay, yeah, I'm going to do that.
I think on the share video feature, it only auto plays the video.
Okay, sweet.
Yep.
Well, let's hope it doesn't lag. I will try my best to not have that. MIM is a public health organization, and we have a lot of members studying public health, but we, just being an undergrad, draw from all disciplines of having micro, macro social work, public health, et cetera, is really great. And as that type of organization with lots of different people in it. We have a lot of different theories of change, but we rarely center conversations about mental health or mental illness in our conversations, in our programs about homelessness. And 2 weeks ago, we had one of our just general meetings. We watched some videos, read some things, and then had a discussion about these topics. And the questions that I'm going to ask today are kind of the things that centered around the things that we talked about as a group. So the first question I have for you all is, how have you observed mental illness confounding the ability to access or maintain housing, especially in privatized housing? And whoever would like to speak first, we can just do it, popcorn style. That's not going in a certain order.
I see a lot of people with mental illness being denied housing for various reasons. Some landlords are very clear that if you have a mental illness and your income comes from Social Security disability, they might say, I don't think you'd fit in here. I rent to students. Maybe you would do better in a group home. These are all the kinds of things that we've heard, the sort of discouragement and the policies that say, working people only. These are all violations of the Fair Housing Act that we enforce. Just so people know, even for a landlord to say something that shows, they don't have to say, forget it, I won't rent to you, you have a mental illness, but I don't think you'd be happy here. Even a discouraging comment is a violation of the Fair Housing Act. Running an ad in the paper that says working people only is a form of discrimination. Also, when people have mental illness, we've dealt with a young man who, because of his mental illness, lived at home until he was 24, 25 years old. So he wanted to get on a waiting list for housing for people who are low income. And they said, well, you don't have any other landlord history. So he said, well, I have a mental illness and I lived at home and now I'm however old I am, and now I'm ready to live on my own. So we did what we got him we wrote a letter of reasonable accommodation. In fair housing law, you have to treat everybody the same, but with disabilities, you have to bend the rules because of specific circumstances. So we were able to get them to bend that rule. And the other most common thing is people who have mental illness live in a property. Let's say their diagnosis changes or their medication changes for some reason, and all of a sudden they're up in the middle of the night, making noise, or just doing something, exhibiting some kind of behavior that is, the landlord or other tenants would find, disturbing. Fair housing law basically says you have to give the person a second chance, where if you didn't have a disability, you'd be evicted, but you come to the Fair Housing Center, we can most likely get you a second chance.
Yes, I would agree with everything that Pam said. And then to add on, if Pam and her group have gone through all of those steps to give someone a chance, even going through applications is challenging, and there are barriers to applications. So application fees can be cost prohibitive. So if someone thinks in the private market, okay, I may need to try 2 or 3 to get to find a place that will accept me, $45 can be very cost prohibitive if you're on a fixed income. So getting that, just even the application fees and moving through those processes can be very challenging for the individuals that we serve, and can be very frustrating and very symptom triggering, and that process can drag out and cause those additional frustrations. So we have a lot of barriers to just even get applications in, and to find the resources to help people do that.
So building on both what Katie and Pam have highlighted, I think I would expand the field a little bit more to also think about the impact that housing then has on mental health. So losing your home is a real trauma. It's a real trauma for adults, and it's also a real trauma for children. And if you look at some of the research that is out there, you can see trails out of the University of Michigan that are a needs assessment with Detroit Public Schools recently. And one of their findings, which, it's not surprising, but sometimes you have to point out the obvious many, many, many times. But, children who were homeless, and this is McKinney-Venter definition of homeless, so they're housing unstable. They had much higher rates of anxiety. They had much higher rates of depression, and much higher ACE scores, so adverse childhood events, which have been linked, again, to worse mental health outcomes, to all sorts of other behavioral health issues. So I think when we think about this intersection of mental health and housing, it's important to think about it from all different angles, both how challenging it can be to get housing when you have a mental health diagnosis or mental health problem, but also how much having housing or not having housing impacts your mental health and where that cycle begins. In the state of Michigan, 8% of elementary school fifth graders, basically, if you look at fifth graders in the state of Michigan, 8% of them have experienced homelessness at some point during elementary school. All of those children statistically have a higher risk for mental health challenges in the forms of depression, anxiety, and trauma. So, we have to think about how these cycles are developing. Likewise, another thing that we see is trauma in kids being really misunderstood as a disciplinary issue. Michigan, as a state, has what I'll call some more antiquated disciplinary practices. At least that's my perspective, having come from New York and looking at similar data points. About 26% of middle school students who were homeless at any point in their education. So in 2017, if you look back to 2019, you look at, or 2009-10, you look at those middle school students who had been homeless at some point, 26% of them were suspended or expelled in one school year. That is, at least in my mind, that is a sign of very misunderstood trauma responses in children. And so that is another piece that we really need to be thinking about, and how we're setting people up long-term for failure or success in the systems that we've created.
In the same thread of thinking about different angles, I also wanted to think about, on the other side of how it is experiencing homelessness confound the ability to access and maintain healthcare. So you were kind of talking about that, Jennifer, with just the side of things of how it can extrapolate different situations, but even just having housing insecurity can, prevent you from making routine appointments or accessing medication. If anyone could elaborate on that, not the trend, but observing that in your work.
I can, go ahead, Laura.
No, you go ahead.
No, I was going to say I could speak to that, but if somebody else can first, that would be great. So you take it away.
I was just going to speak a little bit on the homelessness piece. Just in terms of, especially working with the unsheltered population in Detroit in the past year, or working with outreach teams that were working with the unsheltered populations, understanding that they had huge barriers in, there's a hierarchy of need, right? Like they need food first. Like they're first, they want to secure food. They want to secure where they're going to be for the night. Their mental health and their healthcare needs just take a back seat. I know in a California Policy Lab study from 2019 compared unsheltered populations to sheltered populations, and they were finding that for unsheltered populations, but I'm sure this is true for sheltered populations, it is more likely for them to access healthcare through emergency services, so ambulances, the ER, and so it's really hard for them to access the support that they need, the ongoing services, for various factors. So one can be reliable transportation. Another one is just having the difficulty of the consistent communication, like not having a phone, not having minutes, not having a place to charge your phone, not having internet. You can imagine how hard it is to keep an appointment or change an appointment if you can't communicate with your work, therapist or mental health worker. The reliable transportation crises come up a lot, especially when you're not having the stability you need day to day, night to night. So those are kind of the things that came to mind with your question, Lindsay.
So just sort of building on some of what Laura's already giving as example, there's a lot of, if you want to look through the public health literature, there are a lot of studies that have looked at the worst health outcomes that individuals who are homeless, usually they're looking at literally homeless under the HUD definition, have in comparison to individuals who have been homeless in the past and then have experienced or have been stably housed. So that is really some of the justification that you see in the Housing First movement, both around resolution of substance use, around some of the research around Housing First that I think was really doing in the city was around reducing transmission of HIV/AIDS, because people weren't in the situation when you have no stable place to live. People engage in survival sex, and that is it's not a choice, right? And that was something where after looking at research in that area, they found that having stable housing, really actually was a way to reduce HIV/AIDS transmission, and also to enable people who had HIV to stay healthy. Because if you don't have a stable house to live in, how do you refrigerate your medicine? And the same is true for other, if you're thinking about somebody with diabetes, any chronic condition, managing that while not having a stable place to live is incredibly challenging. I also would sort of turn this to think about unaccompanied minors and unaccompanied youth face incredible barriers to their health. And we need to think about this broadly. You might not be thinking about as much chronic illness at this point, but risk around sexual assault, assault in terms of other forms of violence, substance use, all of these different factors are impacting youth's health, and often they don't have access to services they need. So bringing this to Michigan, one thing that you could think about in particular is that for minors, there's this I think it's accidental, but under the Runaway and Homeless Youth Act, you have 72 hours with which to identify a safe person to connect to around a minor. In Michigan, you have 24 hours. And that is because of licensing laws that minor serving shelters are licensed under child care services in the state or
Oh no. Oh, Lindsay's back.
Go ahead.
Sorry, everyone. We'll get that right back on in a second here.
Yeah, I think we're going to play maybe 4 or 5 more minutes of the webinar and then just close from there.
Sorry, I was kicked out. It probably was my Wi-Fi. I will.
All right. Let me know if you guys need anything.
Impacting youth's health, and often they don't have access to services they need. So bringing this to Michigan, one thing that you could think about in particular is that for minors, there's this I think it's accidental, but under the Runaway and Homeless Youth Act, you have 72 hours with which to identify a safe person to connect to around a minor. In Michigan, you have 24 hours. And that is because of licensing laws that minor serving shelters are licensed under child care services in the state or the laws governing child care services. And therefore, you have to contact and get permission from a parent or guardian within 24 hours. This is something that places unaccompanied minors in extremely risky situations. Just to give you sort of a sense of, if you look at the education data again, There were about 4,000 some youth in the school system, high schools, who reported being homeless and unaccompanied. In our shelter system, there are about 712. That 712 is the exact number from 1 year. It's around 700. It goes up and down. So, but that gives you a sense of the gap between the actual need and the number of youth who are accessing those services. For all those youth who are not accessing those services, that means they are not accessing a doctor. They're not accessing a safe place to stay. So they don't have any of the supports that they should have within our system. And that is a real danger to their health and long-term well-being. So that is a very long answer to your question.
And just a quick point, Lindsay, really quickly, just to kind of wrap that up, I think we see a tremendous amount of that access to care, mental health-wise as well, through the emergency room. And I think a lot of us have experienced that emergency rooms are not intended to provide long-term care. So they're giving short-term, acute prescriptions to bridge you to a primary care doctor. So individuals are receiving these very short-term 7-day prescriptions or interventions that are not meant to be long-term. But a good fraction, about a third of our homeless population, identify the emergency room as their primary care doctor. So there really is no long-term care provider identified for either their physical health or their mental health. So that's a big gap in all of that service delivery.
And I would also say my partner works in the psychiatric ER, both in Michigan and New York. And, one thing you always see is when the weather is bad, the ER visits go up. And that is because there's not available housing. People often are forced to use the emergency room as a place for emergency housing if they can't go someplace else. That is a place that they can get a bed, safe while, some food. So, all of these things I think go back again to why housing first models, have been shown to be important and critical when we're thinking about, the whole person and what it costs too in the context of the system.
That actually, again, leads perfectly to the next question. I phrased it as like, do you believe in the housing first theory? You're not going to hear the next question. But I linked the whole panel that we have, the recording of it, in the chat. So if you're interested in continuing with that panel, you can watch it. There's a lot of really great other conversations. You heard the first 20 minutes of it, so you got a taste. But the panelists that sat on that webinar came from a variety. A lot of them were social workers working in Ann Arbor and Detroit on both the micro and macro level. And yeah, we go into talking about the housing first model of like a theory of change for affecting homelessness, and then have conversations about the differences between mental health, mental illness, and practicing self-care in those fields. So there's a lot of great things that we discuss. And yeah, thank you very much for listening to that. It's very important that, we have these conversations and we just hear this information. If you're interested in interacting and working with the homeless community or just going out into the world, it's good to have, a good understanding of how a lot of different systemic issues we have in our society kind of can have incredible intersections in different areas like homelessness. So yeah, this is the end of our presentation. Thank you, Music Matters, again for the whole year of support. And thank you everybody for joining us today.
Thank you.
Thank you guys both. That was an awesome presentation. I think the webinar was also super, like I said in the comments, it was super insightful. I definitely was able to learn a lot from it and hope that everyone else was too. Just a reminder for everyone, Michigan Movement is one of our community partners. So feel free to check out their table in this last half hour of SpringFest over on the conversation mode spaces. Thank you guys for being here today. And coming up next, right about now, we have our final presentation for the day, which is going to be a performance from Gimbal Acapella. So Grace is here, and Grace, whenever you're ready, feel free to take it away.